Welcome to The Leap with Japa, the podcast that bridges continents and connects stories. Join us as we dive into the vibrant world of international education, explore diverse cultures, and share the extraordinary journeys of students far from home. Whether you're dreaming of studying abroad or already embarking on this adventure through other means, Leap with Japa is your companion in navigating the exciting, challenging, and transformative world of global education. Let's leap into today's episode. Welcome back to another episode of Leap with Japa, the podcast dedicated to helping international students and immigrants navigate their journey in a new country, that is the United States of America. My name is Saheed Adepoju, and today I'm going to be diving into a topic that is crucial for anyone who has recently started working abroad: healthcare and taking care of yourself. Now, it's something that people usually sometimes overlook or downplay as not important, but this episode is personal. So I have, my own story, health story. I might say it in this episode or in a future episodes, but I want to, bring it out here and say your healthcare is 100% priority over everything else. Starting a new job in a new country can be very exciting and overwhelming. And in the midst of all this new responsibilities and opportunities, it is very easy to overlook the importance of health and well-being. Today, I will discuss everything you need to know about navigating the healthcare system in the US, maintaining your physical and mental health, and finding the right balance between work and personal life. When I first moved into the US and settled in California eventually in 2017, I was so focused on proving myself at work that I neglected my health. I didn't know how the healthcare system worked, and I was overwhelmed by the paperwork and new terminologies. And when a health scare happened, I had to change my mind about that. So whether you're an international grad student who's just recently started working, or you're simply looking to improving your health and well-being, this episode is for you. So let's get started. So first thing I'm going to talk about is mental health and well-being. So one of the biggest things about the word mental health is we think, oh, not for me. I'm okay, I'm fine, I'm good. But there is a lot of things that goes into this. So mental health is just as important as physical health, especially when you adapt into a new country, a new job, and a new life. This segment that I'm going to be talking about, mental health, I want to explore mental health and well-being for both people who are in STEM, you're a STEM professional, or non-STEM, people that don't do anything with computers. So, mental health is crucial for maintaining overall well-being. It is important to acknowledge and address any mental health issues early on in order to prevent them from affecting your work and personal life. So typically, cultural stigmas around mental health can make it difficult to seek help, but remember that taking care of your mental health is a sign of strength and not weakness. So what exactly are those things that can cause these things? So first thing is isolation and a sedentary lifestyle. And this particularly goes for people in STEM. So if you are into IT, or if you are into technical work, software engineer, or whatever form of computer engineer, STEM professionals typically spend very long hours working on computers, which can lead to feelings of isolation and a sedentary lifestyle. So what's a sedentary lifestyle? You just sit in the same location or you don't move too much. It's important to take regular breaks, move around, and engage in physical activity. Another thing with the unique challenges for STEM professionals is the high stress and burnout. The tech industry is known for its high-pressure environment and tight deadlines. Managing stress through techniques like mindfulness, meditation, and proper time management can help prevent burnout. So you need to figure out how you can reduce the burnout. You need to learn how to take breaks. Another thing that causes high mental stress is screen time and mental fatigue. If you spend so long, prolonged screen time can cause mental fatigue and eye strain. One of the things that you should consider doing is the 20-20-20 rule, which is for every 20 minutes, take a 20-second break to look at something 20 feet away. So always take a break from your computer screen every 20 minutes. For other people that are not STEM professionals, so for those that have physical jobs that are physically demanding, that can lead to physical fatigue and stress. And you have to ensure adequate rest and recovery in order to make sure that you don't burn yourself out. Another thing is if your job involves a lot of social interactions, maybe you are someone that has to do a lot of meetings and things like that. Jobs that involve a lot of social interaction can be mentally exhausting. Finding time for self-care and quiet moments can help balance social demands. So that's another thing. If you might not be a screen type person, you might be someone that interacts a lot, someone that uses social media for marketing and things like that. You want to talk to a lot of people, you need to be able to do that. Another thing that a lot of people don't realize is the nature of the food in the US. So coming in from another country, you probably are used to eating certain types of food, so vegetables and meats and stuff like that. One of the things that you typically have is because of the nature of your job, you are prone to eating out or eating fast food. So the food landscape in the US can be quite different from what you're used to in your home country. So you have things like processed foods, larger portion sizes, and prevalence of fast food can impact your diet and health. So there are lots of sugars in this food, lots of salt in this food, lots of sodas. So because people are very busy, in a very fast-paced environment, you quickly grab what you can eat. One of the things that you need to understand is most of this food have interactions with your body that is different from what you're used to. So when your body sees something very different, it changes, it manages it very differently, which can produce effects that you've never had before. And they combine that with a high stressful environment. It's like a perfect mix for a stressful environment. So one of the things that this does on mental health is a diet plays a significant role in mental health. Consuming high amounts of processed foods, sugars, and unhealthy fats can lead to mood swings. So that's one thing it does. Anxiety and depression. On the other hand, a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can enhance mental well-being. So you have to be very specific about the kinds of food. Now, you're probably thinking, but I used to eat all these foods back in my home country. Yes, they're not made the same way in the US. The US prioritizes making these foods available so that people don't go hungry, but they don't ensure that these foods are well, gives you the nutrition that you need. They just want to make the availability available. So you need to be able to understand that you have to be mindful of your food choices. Opt for home-cooked meals whenever possible. Make sure you buy stuff and then you cook it. Another thing you can do is, if you must buy meat, probably buy meat from a farm. You don't have to buy meat from a Walmart or a Target. Nothing against them. It just means that at a certain point of time, you have to start prioritizing even where you get the meat and veggies to be able to provide yourself very good nutrients. So you have to make sure you incorporate a variety of nutrient-dense foods into your diet. Understand how different food affects your body and mind, and make informed decisions to support your health. So you have to make sure you are eating the right kinds of food, because they go a long way. Because the high stressful environment, your food can make or break you. Sometimes you might eat food that would change your mood or you feel happy. So, happy foods, sometimes it's probably lots of sugar because, it changes your mood and you're happy. And then when you get very happy with, high sugar content food, your body crashes later on and you're asking for more sugar in order to keep you at that emotional high. So you have to be very careful to understand. So next thing I'll talk about is resource for mental health support. A lot of people, again, like I said, you're hearing mental health and you're tuning it off. Please don't. It is for real. Many employers offer employee assistance programs that provide confidential counseling services. Universities often also have mental health resources for students as well. So if you're an international student, this also helps. You can use online resources. BetterHelp and Talkspace offer online therapy sessions that can be more flexible and accessible. Support groups. Joining support groups either in person or online. I would say you should join support groups in person. You don't want to add an online component to something that you're already online for your job. But, better to have something than nothing. So either online or in person can provide a sense of community and shared understanding. Another thing you can do is you find, if you're religious, like I am, you find a church community. This has helped because then you have 2 times a week where you can go in for Bible study, or you can go in to do a service. So if you're Muslim, look for a community, look for a mosque where you can also go in, have the imam that you can speak to. You can also ensure that you have weekly activities that you go to so that you can mix with people in the community, because you want to be able to have people to speak to. So always look for one of these places where you can, connect. So that's one thing I would suggest for a support group. Tips for managing stress and maintaining mental health. Have a consistent daily routine. So for me, I go to the gym. I get up at 5:15 a.m. every day, and I get to the gym at 6 o'clock, and I have 20 to 25 minutes of cardio on the Stairmaster, and I make sure that, I put in like 200-300 calories on the Stairmaster. Then I get off and I do some strength training for another hour. So I'm in the gym from 6 o'clock to 7:30, and then I get back to work, get back to the house, and then I get, my kids ready for school, and then I go to work. If I have to be in the office, I jump in the car, drive to the train station, get to work. So if you have that consistent routine, it goes a long way to helping you. So that's one way that I manage stress. You have to actively, burn the stress. Not burn the stress with taking meds, burn the stress with doing actual exercise. So having a consistent routine helps you. Set boundaries. It's important to set boundaries between work and personal life to ensure you have time to relax and recharge. Stay connected. Making and maintaining connections with family and friends, both locally and back home, can provide emotional support and reduce feelings of isolation. Also, practice self-care. Engage in activities that you enjoy and that helps you to relax, whether it's reading, exercising, or pursuing a hobby. Case in point, this podcast is a way for me to manage and maintain my mental health. I do this as a way to provide you information that is relevant to me, but at the same time, I use this because I have a routine. Every single week, I have to come up with new episodes. It keeps my mind in check. It keeps me happy because I enjoy providing this information to you. Does it cost you anything to listen to this? But it gives me an opportunity to share what I want to do. So this podcast, Leap with Chakra, is a very good way for me to, maintain my mental agility and mental stress. So that's one thing you can do. Find a hobby. If it's reading or writing you know how to do, keep writing. If you are a blogger, blog. If you want to start a podcast, feel free to reach out to me. I'll be very happy to give you all the resources, because this podcast is a work of passion. The next thing I want to talk about is physical health. I have just talked about how I manage mental stress with physical exercise. So physical health is the next thing. Now, taking care of yourself, taking care of your physical health is just as important as managing your mental health, especially when you are navigating a new environment. In this segment, I'm going to cover the key aspects of maintaining physical health. Finding and using local gyms and fitness facilities. Many cities in the US have a wide variety of gyms and fitness centers. Look for the one that fits your budget and offers the amenities you need. Some workplaces also provide gym memberships or have on-site fitness centers. Local community centers often offer affordable fitness classes and recreational facilities. This can be a great place to stay active and meet new people as well. Outdoor activities. Take advantage of local parks and outdoor spaces for activities like walking, jogging, cycling, or hiking. California, for example, where I stay, has numerous trails and parks perfect for outdoor exercise. Another thing is regular exercise, just like I mentioned initially. Regular physical activity exercise helps improve cardiovascular health, strengthen muscles, and boost your mood. That is very important, mood boosting. So if you're stressed and you do cardio and you do strength training, it will change your mood. It can also help mitigate negative effects of a sedentary lifestyle, especially for those in STEM who sit in front of a computer for long hours. And then incorporating exercise into your routine. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activities each week. So notice each week, I do an hour 30 minutes 4 days a week. So they're saying 150 minutes of moderate every week. That's what I'm proposing. But if you can do more, even better. Even small changes like taking the stairs instead of an elevator or going for a short walk during lunch breaks can make a big difference. Another thing is your diet and nutrition. Focus on a balanced diet that includes variety of fruits, vegetables, lean proteins, and whole grains. This can help you maintain energy levels and support overall health. The reason why you do this is because if you do vegetables, you're more likely than not to get good health stuff. Even though most of the fruits and vegetables can contain sugar, because America is very funny with some of the foods, but it's better than processed foods. So aim for that. If you can, understand the food labels. Understand what you're eating. So learn to read the food labels to make informed choices about what you're buying and about what you're eating. Be mindful of portion sizes, the added sugars, and unnecessary fat. Meal prep. Preparing your meals at home allows you to control the ingredients and portion sizes. It can also save you money and reduce the temptation to eat out frequently. Again, eating out means that you're burning cash and you do not know, what you're spending your money on. So you have to be very careful. Also, another thing that is very important is preventive healthcare. I practice that a lot. I do blood work every 3 to 6 months, and essentially preventive healthcare is is when you schedule regular checkups with your primary care physician to monitor your health and catch any potential issues early. Preventive care such as annual physicals is often covered by your health insurance at no additional cost. Make sure your vaccinations are up to date. This can include flu shots, tetanus boosters, and other vaccines recommended for adults if you want to take those vaccinations. I am not mandating them. I'm just telling you that it is an option when you go for your annual physical. Do your dental and vision care. Regular dental checkups and eye exams are important for maintaining overall health. Yes, I know my eyes are good, my teeth are good. Check them, please. You just never know. Don't take it for granted. Now, also drink lots of water throughout the day to stay hydrated. Very important. Water supports your bodily function, keeps you hydrated, reduces the fog in your brain and your mind, and goes a long way. If you can, avoid alcohol. Please limit the intake of alcohol. Avoid smoking. Yes, if you are someone that smokes, there is lots of complications that can come with that. You can have high blood pressure. You can have type 2 diabetes. You can have kidney problems. There's a combination. And the moment you become a chemistry set, when you take multiple drugs for high blood pressure and things, becoming a chemistry set in the American healthcare system is very dangerous because most of the drugs that you take, no one has ever done research on them for how they interact with each other. So be very mindful, be very careful. So the next thing I'm going to talk about is work-life balance. And this is quite important because a lot of people talk about, oh, I've got my job provides me work-life balance. But what is it? Achieving a healthy work-life balance is essential for long-term success and well-being. As an immigrant starting a new job in a new country, it can be challenging to balance the demands of the work with personal life. In this segment, I'm going to explore ways by which you can find that balance. Set clear boundaries. Establish clear boundaries between work and personal life. This means setting specific work hours and sticking to them and avoiding work-related tasks during personal time. So if you're off at 4 o'clock, please do not reply to that email. Even if that email was sent by the CEO, reply it during work hours. The world is not going to end. And remember, even if you reply and, you get sucked in, remember, if anything happens to you, the company will continue. Nothing would happen to that company. We see how Steve Jobs died a long time ago. Apple still exists. I'm sure, there are lots of things he could have told himself about taking care of his body, but Apple still exists today. So, set clear boundaries, prioritize tasks. Use tools like to-do lists or project management apps to prioritize your tasks and manage your time effectively. Focus on high-priority tasks and break larger projects into manageable steps. So, prioritize your tasks. Learn to say no. Don't say yes to everything. Why? It's important to recognize your limits and not take on more than you can handle. Politely declining additional work or commitments can help prevent burnout. Importance of taking time off. Please utilize your vacation days. It is there to be used. Take full advantage of your vacation days and personal time off. Use this time to relax, recharge, and do activities you enjoy. Plan regular breaks. Incorporate short breaks throughout your day to rest and rejuvenate. Even a 5-minute break can make a big difference in your productivity and mental clarity. Disconnect from work. Make it a habit to disconnect from work during your time off. Avoid checking emails or taking calls during vacations or weekends. I don't do any work over the weekends anymore. There is no amount of work you're going to give me. I'm not going to show up on the weekend for anything. Integrating into your workplace culture. Understand the workplace norms. Take time to understand the norms and expectations of your workplace. This includes dress codes, social interactions. Build relationships, with colleagues to enhance your work experience. Engage in team activities, attend social events, and be open to making new friends. Find a mentor within your organizations who can provide guidance and support as you navigate your new job. Please engage in hobbies and interests. Make time for your hobbies, activities that you enjoy outside of work. This can provide a sense of fulfillment and help you relax. My podcast is a hobby, which is why you're listening to this right now. Practice mindfulness and relaxations. Techniques such as meditation. I'm not a fan of meditation though. And deep breathing. But for me, the way I practice mindfulness and relaxation is by going for a run or taking taking steps on the cardio machine, something, because by the time you're done with that, it relaxes your body. It releases endorphins, which kind of calm you down. So that's one way to relax. And of course, your regular exercise. Make sure you go to a gym, and please go out, touch grass, understand how things work. See how things work for once. Don't always assume that there's no life outside. Always take time off. So another thing that I want to talk about is practical tips. You need to understand there's some practical tips that you need to navigating everyday life in America, your new country. I'm hoping that these tips would help you handle emergencies, stay organized, and make most of your available resources. So, first and foremost, know your emergency numbers. In the US, the emergency number is 911. Make sure you know the emergency numbers for your local police, your fire department, and your ambulance services. Also, have information for gas, the number to call for gas in case you smell gas. Always have that as well. Prepare an emergency plan. Have a plan in place for different types of emergencies, such as medical issues, natural disasters, or personal safety concerns. Make sure you know the locations of the nearest hospitals, urgent care centers, and safe shelters. Save the number. What I mean is, you need to keep important contacts handy. So save the contact information of your primary care physician, your doctor, your health insurance provider, your local embassy or consulate, and close friends or family. Also, I use a lot of apps. So I have fitness tracking apps. So I have an Apple Watch where I can track my fitness and set goals and keeps me motivated. I have apps for health management. So things like Apple Health and Google Fit can help you to track all of that. Also, you need to have the app for the hospital that you go to make sure that you are able to understand how your tests are going over the year. So I use the Kaiser app. I'm a member of the Kaiser health insurance, and what I do is to be able to track. I've been tracking my health in America since 2017, so I have all the stats for my healthcare, and the typical tests that I do are all involved around everything. So just to give you an idea of the way I do my thing is every 3 months I go into the hospital and I ask for an annual physical. And in the annual physical, we do a bunch of tests. And the aim of this is to be able to track if everything is going well. So I'll give an example of a run through of what I do. I do creatine tests, which is to check stuff, my kidneys. I do potassium tests. I do thyroid stimulating hormone tests, uric acids. I do A1C. A1C is to check my A1C level, which is to see if you're diabetic or not. This was a big indicator for me recently, where my A1C levels were going up, and the doctor was of the opinion that I needed to immediately go on insulin, but I was able to not do that because I hit the gym, and in 3 months I reversed my A1C and I was no longer diabetic. So, those are the things that are important, because what is the use of making so much money but you have a terrible health situation to enjoy that? So that is why this is very important to me. So other tests that I do include glucose, non-fasting lipid panels. I do vitamin B12 tests. I do the complete blood counts. I do my white blood cells, red blood cells, potassium, and glucose. I do a host of these tests to make sure that I, essentially, keep in myself. So, maintain a record of these. Another thing you need to do is you need to understand the healthcare system. So you need to, when you get a new job, you sign up for health insurance. Please do not overlook and say that I don't need a health insurance. I'm well in Jesus' name, or by the grace of Allah, my health is good. I'm sorry, you're in a new country now that the foods can interact with your body and cause a whole wrecking ball on you. So please do not neglect that. Do not say you're good, you're fine, you feel fine. No, do not do that. Make sure you sign up for healthcare. You have a new job. Your employer is paying for your healthcare. They pay a premium. That's part of your package. That's part of your pay package. Averagely, a company would pay at least $20,000 or $30,000 every year for your healthcare. You pay a portion of that every month. You don't have to pay $30,000. They give you an opportunity to pick a doctor, pick a healthcare. So that there are different types of health insurance. There's the one where you can pick any doctor in a network, and you can go to that hospital because that hospital is in that network. So pick a good hospital, pick a doctor, and make sure you book appointments every single time. Whenever you go for an appointment, if it's a preventive appointment, preventive healthcare, the copay is usually very small. It depends on the kind of insurance you have. My insurance, I don't pay for preventive healthcare. I don't pay for blood work as well. Other places you'd have to pay for blood work or a copay. A copay could be $50, $60, $100, something that you pay, and then your insurance kicks in and covers the rest. So please be aware of what you're doing. When you're signing up on the dashboard on your healthcare, it tells you how much you're gonna pay. Please don't always assume that you pick the cheapest. Please pay for good healthcare, and not just pay, please use your healthcare. So once you go in, make sure you do your blood work every 3 to 6 months. I just read you a list of the blood tests. The doctors know what that means. They will check your blood work and they will tell you where you are. They'll tell you what you need to do, and you need to be able to track that. So that's one of the first things you need to do as an international student. Please make sure you do your blood work and know where you are. Jesus, God, Allah, or whoever you worship is not going to come down and change the DNA consequence of the food you eat in your body if you eat junk. It's not a miracle. It's not going to change. You need a lifestyle change to make sure that your body is active. I keep on stressing this. This is very important. Make sure you know what you are internally, because what you are internally would always bring itself out eventually. So if you don't take care of yourself internally, it's going to come out in form of stress. You're going to be ill. If you're able to know where you are preventively when you do your tests, then you can do exercise to counteract anything. If you decide to take drugs and feed your body on big pharma drugs and big medicines that you did not do any research on, on how they interact with other drugs, you would be a chemistry set. You would be that set where one drug deals with one thing, another drug deals with another thing, and they don't know how they interact because different companies made them. So the gym, I keep on saying this, the gym, the fitness places is the cheapest form of healthcare you can get in America. Go to a gym, go register in a gym, pay a personal trainer to give you the tips on how to get better. Because if you don't do this, you will pay dearly for this in 10, 20 years. Your body would be destroyed because of how much food you've taken. You would not have the mental capacity to go on, and then you would not be effective at work, which would lead to kicking you out, and then you don't have money to keep yourself in the country, or you lose your job, and then you become mentally frustrated, and you can't handle the stress, and then you lead to a burnout, and then you're out on the streets. So the healthcare is, I repeat, the most important bit of your life in the US. If you do not take it seriously, you will destroy your life entirely in the US. Everything you worked for will go down the drain if you do not take care of yourself. So I stress this again. Make sure you know your numbers. Make sure you know your tests. You know your cholesterol level, your glucose level, your blood pressure, your A1C. You know where it stands. You know how the trend is going. The moment it's going up, find out how to reverse it. Most of the reversal can be done in the gym. Get into a gym. Exercise an hour a day. 3 days a week minimum. 2 days a week. Whatever. Make sure you get into a gym. And make sure you get yourself sorted out. If you do not do this, this is probably one of the biggest episodes that I'm going to release. If you do not do this, if you do not, repeat, fix yourself, mentally, physically, and take care of your body, take care of your mind, you will burn out and you will crash and burn. America is for the long haul. Do not jump into ignoring your body and prioritizing making money or prioritizing making headway in your professional career. If you neglect your body, if you don't have any form of exercise, doesn't have to be the gym. You can play soccer, you can play basketball, you can play cricket, you can play anything. If you're not doing anything physical to help your body to burn stress, you will burn out and it will be the worst thing that ever happened to you. Okay, that's just going on a huge rant. I hope you can tell from my voice that this is really important to me. I hope that you would use this episode as a way to ensure that you get yourself back, learn a lot to get yourself back in check if you have derailed. I also hope that you use this as an opportunity to learn about how the healthcare system can help you bounce back. Do not neglect checking your blood work every 3 to 6 months. I just did mine last week and I'm all clear, excited to move on. And yes, I hope this episode has brought you a lot more information, and I've been grateful I've been not grateful. I've been very privileged to share this with you. It's a personal episode for me because I have been through a lot of health scare, so I know how this is very important and how this can be very, very detrimental to you if you do not take care of it. So I'll probably talk about the health scare in another episode. I'll talk about sleep apnea, type 2 diabetes, and things like that you should watch out for, something that is very important. So most people are prone to high blood pressure, type 2 diabetes, sleep apnea. Those three. A lot of people don't deal with sleep apnea. Sleep apnea has a direct correlation with type 2 diabetes, if you do not know. So if you're not sleeping well, if you're waking up in the middle of the night to go to pee every hour, you probably have sleep apnea. You have high blood glucose in your blood system, which is type 2 diabetes. And I'm not a doctor, so I'm not here to diagnose you. But this tells you that if you have some of these, you are probably, prone to some of this. Are you sleeping in the afternoon? Can't stay awake in the afternoons? You're tired, burnt out? Probably have one of these. Anyways, this would be the end of this episode. I thank you very much for listening to me thus far. I hope you've had a great weekend, and I look forward to speaking to you on another episode. And until then, keep leaping, keep enjoying yourself, and speak to you soon. Thank you very much. Thank you for tuning into this episode of Leap with Jackma. I hope it brought you valuable insights and stories that resonate with your journey. If you have any thoughts to share, questions, or want to send a voice note with your feedback, please visit our website at leapwithjackpa.io. You will find a contact from there. I would love to hear from you and feature your voice in a future episode. Don't forget to subscribe to the podcast on your favorite platform, some of which are Apple Podcasts, Spotify, iHeartRadio, or Player FM. Your subscriptions and reviews help us grow and reach more listeners, and I truly appreciate each one of them. Also, check out our merch store on leapwithjackma.io website for some cool t-shirts and hoodies, perfect for showing your support for the show. Stay tuned for our next episode, where we'll dive even deeper into the experiences and challenges of international education and careers. Until then, keep leaping forward, and thanks again for being part of the Leap with Jackpa community.